When a loved one shows gradual but unsettling changes, it's easy to underestimate them. In the past, many people thought that death in old age happened suddenly, but that's not how it works. In fact, the body gives subtle warnings months, or even a year, in advance before it reaches its final stage. The problem is that most people don't notice these signs, as they seem irrelevant at first. Only later, when looking back, do families realize that the signs were there all along. But at that point, there are no more opportunities to organize or experience special moments. In this article, we'll explore 5 important warnings that usually appear around a year before the death of an elderly person. Some can be easily associated with the natural advance of age, while others, although discreet, reveal a progressive deterioration in health. Recognizing them in advance makes it possible to improve care, prioritize valuable experiences, and, above all, ensure that your loved one has peace of mind, respect, and well-being in their final days. Understanding these signs reduces the impact of surprises and allows you to make the most of your time with them. 1. Weight loss without apparent cause. One of the most significant indicators that someone is entering their last year of life is involuntary weight loss. At first, it can be almost imperceptible: a pair of trousers getting baggy, a watch slipping down the wrist, or a natural decrease in hunger. Although some attribute it to the aging process, losing weight for no apparent reason is rarely something without consequences. This phenomenon usually reflects the body's inability to assimilate nutrients as before. Muscles weaken, vital functions slow down, and although a reduction in muscle mass is common over the years, an accelerated decline can indicate more serious complications. Possible causes include digestive difficulties, impaired protein absorption, or even chronic conditions such as cancer, heart, or kidney problems that have not yet manifested themselves in any obvious way. Another relevant factor is a loss of interest in food. Flavors that once appealed can become bland, and many older people start eating less or skipping meals. This isn't simply a change of habit. It's a physiological reflex that the body is slowing down. The brain reduces hunger stimuli, resulting in less mood, greater frailty, and an increased risk of illness. It's common for family members to try to get around the situation by offering favorite dishes or nutritional supplements. But it's important to bear in mind that, at this stage, weight loss is linked to complex mechanisms, not just a lack of appetite. If the weight continues to drop despite your best efforts, it's essential to realize that the problem goes beyond food. The body is undergoing a deeper transformation, and insisting on large meals may not be the solution. Instead, prioritizing easily digestible foods and maintaining good hydration may be more effective in preserving well-being. When an elderly loved one shows marked weight loss, especially if it is accompanied by a decrease in appetite, growing weakness, or difficulty carrying out everyday activities, it is a warning that should not be ignored. It's not just a physical change, but a signal from the body, and interpreting it correctly allows you to act with awareness and empathy, making each moment more meaningful. 2. Overwhelming exhaustion and loss of strength. One of the most striking signs in the last year of life is intense and constant fatigue, which doesn't improve with rest. It's not the usual tiredness after a long day, but a deep exhaustion that turns simple tasks into challenges. Getting out of bed, walking to another room, or even talking can require an unusual effort. This extreme weakness is not just a consequence of age. It reflects a body in transition, which redirects its energy towards vital functions as organs and systems slow down. The heart loses efficiency, blood circulation becomes less vigorous, and muscles receive less oxygen, which explains the instability and difficulty in maintaining previously routine activities. In addition, the metabolism adapts in this final phase. The body stops prioritizing movement and starts conserving resources, leading to the need for prolonged sleep and frequent naps. Sudden drops in energy. The person seems fine one moment and completely exhausted the next. Recognizing these signs helps to adjust expectations and offer appropriate support, focusing on the comfort and dignity of those we love. But perhaps the most painful aspect of this process is the emotional impact of fatigue. Many older people who were once proud of their independence begin to feel frustrated or even ashamed that they can no longer carry out activities that used to be simple for them. They may withdraw from conversations, avoid social interactions, or abandon hobbies they once loved, not for lack of interest, but because they simply don't have the energy. This wear and tear can create a cycle of isolation, in which the person stops trying to connect with others, further accelerating their physical and emotional decline. For families, seeing a loved one go from being active and participative to exhausted and reclusive is deeply difficult. It's common to think that they're being lazy, or that they just need to try harder, but the truth is that forcing activities won't help. What really matters at this stage is respecting their limits and allowing them to rest when necessary. Prioritizing comfort, adapting the environment and expectations, creating meaningful moments without demands, whether in silence or in small, affectionate exchanges. If you notice that a loved one is experiencing continuous, incapacitating fatigue, realize that this is a sign that their body is undergoing a profound transformation. This is the time to offer presence, patience, and love, without demands. In the end, what remains is not how much they could do, but how much they felt welcomed and loved. If you're watching this video and find this information useful, comment 2 below so I know you're following along. And if you haven't subscribed yet, don't forget to activate the bell to receive all our content. Your support helps us to continue producing material that informs and inspires. 3. Mental confusion or cognitive impairment. As a person approaches the end of life, one of the most striking changes occurs in their ability to think, communicate, and interact. You may notice that someone who used to be lucid and participative begins to forgetting facts frequently, having difficulty following conversations, appearing disorientated even in familiar surroundings. Other signs include repeating sentences, forgetting the names of people close to them, or losing track of time, even if they've never had memory problems before. These cognitive changes can appear months or even a year before the death. This is not normal forgetfulness. The brain, like any other organ, depends on oxygen and nutrients to function. When the body declines, blood circulation and vital functions weaken, directly affecting mental clarity. But as blood circulation becomes weaker and oxygen reaches the brain with difficulty, cognitive abilities begin to deteriorate. The person may experience frequent mental confusion, difficulty making simple decisions, problems recognizing family members or places they have known for decades. In some cases, there may be moments of lucidity interspersed with episodes of abrupt disorientation, as if the mind were oscillating between presence and forgetfulness. Emotional distancing, when the outside world loses meaning. Another common sign is a drastic reduction in interest in social interactions. You may notice that your loved one speaks less and less, seems uninterested in conversation, spends long periods in silence, absorbed in their thoughts. This doesn't mean that they no longer love their family. The brain, in decline, no longer processes emotions or stimuli as it used to. Conversations become exhausting. Noisy environments cause overload, and gradually, many older people turn inwards, as if they were preparing for an intimate journey. Changes in mood, irritability, apathy, or indifference. In addition to isolation, behavioral changes are common. Some become irritable or anxious for no apparent reason. Others become exceptionally calm, almost indifferent to things that used to thrill them. These changes do not reflect a new personality, but rather the brain adapting to the weakening of the body. The ability to express feelings diminishes, and reactions that were once natural, such as laughing at a joke or worrying about a grandchild, can simply disappear. How to support. during this phase. For families, seeing a loved one gradually disconnect is distressing. It can feel like they are losing them before they physically leave. But it's crucial to realize that this is beyond their control. Instead of insisting on conversations or activities, focus on quiet welcome. Speak calmly, hold their hand, offer reassurance without demanding answers. A peaceful environment. Reduce noise, bright lights, and agitation. A serene space helps to avoid sensory overload. Presence, not performance. Even if he doesn't react, your company conveys love. Research suggests that hearing may be one of the last senses to be lost. If you notice persistent mental confusion, apathy, or progressive isolation, don't ignore them. These are signs that body and mind are in transition. Enjoy the intervals of lucidity, but don't force situations. What matters now is dignity, peace, and the certainty that, even in silence, they are not alone. 4. Frequent infections and slow healing. As the body enters its natural decline, the immune system loses strength, and one of the most obvious signs is the inability to fight infections as before. Someone who used to rarely get ill can start catching colds, flu, or urinary infections repeatedly, and even small cuts or bruises take weeks to heal. Why does this happen? Weakened organs and circulation reduce the production of defense cells. Medicines lose their effectiveness because the body no longer metabolizes them as it used to. Simple wounds become chronic due to the lack of oxygen and nutrients in the tissues. Infections such as pneumonia, UTIs, urinary tract infections, or even skin lesions become frequent and difficult to treat. What used to be solved with a common antibiotic now requires higher doses or hospitalization. Sneaky signs. When there's no fever. In the elderly at the end of life, infections don't always follow the expected pattern. Instead of a high fever, look out for sudden mental confusion, the first common sign, extreme fatigue or loss of appetite, changes in behavior, unusual agitation or apathy. What can you do? Prevent infections. Maintain hygiene, moisturize dry skin, and move the bedridden patient to prevent ulcers. Monitor small wounds. A cut that doesn't heal can become serious. Watch out for silent signs. Cognitive changes or sudden weakness can indicate a hidden infection. Because even when words disappear, love can still be felt. At this stage, comfort comes not from speeches but from gestures. Gentle touch, a hand holding his. Calm voice, recalling stories or simply saying, "I'm here." Cozy silence, allowing him to rest without demands. The brain may not process words, but human warmth is still perceived. Studies show that even in a state of unconsciousness, the voice of loved ones can soothe. 5. Changes in breathing and circulation. Signs that the body is preparing. One of the clearest indicators that the body is entering its final phase are changes in breathing and circulation. You may notice that your loved one breathes more slowly and shallowly than before, has long pauses between breaths, sometimes frighteningly long, has an irregular rhythm with rapid breaths followed by sudden decelerations. Some people develop a pattern called Cheney-Stokes breathing, characterized by cycles of deep, rapid breaths followed by breathless intervals. These changes may start out subtle, but become increasingly evident over time. Signs of poor blood circulation. As the heart loses strength, the body redirects blood to the vital organs, reducing the flow to the extremities. You may notice hands, feet, nose, and ears that are cold to the touch, pale, bluish, or blotchy skin, especially on the fingertips, swelling in the legs or feet due to fluid retention. In addition, shortness of breath becomes frequent, even with minimal activities. Peaking a few sentences may require pauses to catch your breath. Changing position in bed can leave you gasping. Some breathe predominantly through their mouths, with gurgling sounds, due to the buildup of fluid in the lungs. How to help in this phase? Keep calm and comfortable. Raising the head slightly with pillows can make breathing easier. Humidifying the air or using oxygen, if prescribed, relieves the feeling of suffocation. Don't insist on force feeding. At this stage, the body doesn't prioritize digestion. Offer liquids in small quantities to avoid choking. Gentle touch and quiet voice. Even if the response is minimal, your presence conveys reassurance. Observe without correcting. Irregular breathing patterns are natural. Avoid adjusting their breathing. This can cause more stress. When healing is no longer possible, comfort becomes the greatest act of love. If you're experiencing this, comment 5 below. Your journey matters. And if you haven't subscribed yet, activate the bell to receive more content like this. It's not just a cold. Understanding final respiratory changes. Many interpret wheezing or lung congestion as a simple cold, but in the elderly at the end of life, it signals weakening lungs. Lying down can become unbearable, and many prefer to sleep semi-sitting up, propped up on pillows or in recliners to ease the difficulty of breathing. For families, witnessing this change is distressing. It's natural to want to encourage deeper breaths, but the body no longer can. Rush to urgent interventions when the focus should be on comfort. These changes are part of the body's natural process of slowing down. Although they are not reversible, it is possible to reduce the discomfort. Cool, humidified environment relieves dry airways. Small sips of water prevents choking. Oxygen or palliative medication, only if they relieve distress without prolonging suffering. Signs that circulation is decreasing: cold hands and feet, pale or bluish skin, especially on the extremities, irregular breathing patterns, long pauses between breaths. This is because the heart prioritizes vital organs, reducing peripheral blood flow. It's not an emergency, but a warning that the body is conserving energy for the essentials. Final reflections. What really matters? By reviewing the 5 signs discussed: involuntary weight loss, disabling fatigue, mental confusion and withdrawal, recurrent infections, changes in breathing and circulation, we understand that it's not about fighting death, but honoring life until the last breath. What you can do now. Accept the body's limits. Encouraging food or activity beyond what is possible only creates stress. Prioritize comfort. Touch. A soft voice and welcoming silence are worth more than aggressive medication. Make decisions in advance. Talk about final wishes, care, environment, preferences, while there's still time. Death is not the enemy. The enemy is lonely suffering. Recognizing these signs is not about giving up, but about transforming grief into active love. When we accept reality, we can create peaceful memories, like telling stories or playing favorite songs. Ensure dignity by avoiding unnecessary invasive procedures. Say, "I love you," in 1,000 ways, even when the words are no longer heard. If this content resonated with you, leave a comment below. Your experience could light the way for other families. This is the time to celebrate life, even in parting. When you notice these signs in a loved one, the journey can seem lonely, but you're not alone. This is the time to keep stories. Talk about moments that defined them. Laugh at memories and thank them for their presence. Offer silent presence. Sometimes a hug or a hand holding theirs speaks more than 1,000 words. Validate their value. Say you matter through gestures. A favorite photo on the table, a warm blanket, their favorite music playing softly. You don't have to be strong all the time. Recognizing these signs is painful, but knowing what to expect can bring patience to accept the difficult days, clarity to prioritize comfort, not healing, peace to understand that love is not measured in interventions but in shared moments. An invitation to you. Share below. What insight from this video touched you the most? How will you apply it to caring for your loved one? Spread this message. Like, subscribe, and share with those who also need this understanding. Allow yourself to feel. There is no right or wrong in anticipatory grief. Your pain is valid. Thank you for walking with us through this difficult but necessary conversation. Your support turns our work into purpose. Until the next video, where we'll continue talking about how to live well until the last goodbye. Parting doesn't erase love. It only proves that it was, and always will be, real.